Hello and welcome to the Sanford Humanities Community Lecture Series. My name is Jordan Baye. I'm a pharmacist with Sanford Humanities and also have a background with a master's degree in bioethics.
Hello, my name is Gretchen. I'm an ethicist with the DeGroot Center at Sanford Health. My background is a Master of Bioethics and a Master in Divinity from Wake Forest University.
And I'm Kristen DeBerg, and I'm one of the genetic counselors here at Sanford Health. I work in the cardiovascular department. I have a master's in genetic counseling and a master's in biological sciences, and I also sit on the biomedical ethics committee.
All three of us are affiliated with the DeGroot Center at Sanford Health, a center for bioethics, humanities, and the healing arts. The DeGroot Center is a resource available to patients, families, and all healthcare workers. The DeGroot Center functions within the realm of ethics consultation, committees, and ethics education.
When we were asked to come up with a lecture discussing ethics, genetics, and healthcare, we thought of a movie that was old and called Yours, Mine, and Ours, and it just felt like it really fit with how we think about ethics, because many of us come from different backgrounds and we all have our own views on ethics. And so that's the title of our talk today, is Yours, Mine, and Ours, and we're concentrating on ethics. And some of this comes into play most recently when many of us have probably seen commercials or heard ads for different direct-to-consumer tests. Some examples would be 23andMe and Ancestry.com. And a lot of individuals have taken an interest in submitting samples for these tests. And I think it's important that everyone thinks about their own reasons for doing these types of direct-to-consumer tests. Are they interested in different medical aspects of their history for themselves or from their family history? Are they more interested in their ancestry, or are they all just looking for the funsies? So as you walk through this presentation with us, think about those who have done the testing and consider why they have, or those who have chosen not to. And again, why is that the reason that you've decided not to pursue those types of tests?
The intersection of ethics and genetics becomes even more relevant when we consider some of the growing technologies or resources available, such as Kristen was talking about direct-to-consumer testing. So an overarching question that leads us in our discovery and conversations and curiosities with ethics and genetics is, now that we can, with increasing hope of success, use new technologies to prolong the lives of catastrophically ill patients, or change the ordinance of a life to be, must, and I guess we should say should, we always attempt to do so? So that question encompasses both the beginning and the end of life and everything that comes in between, and the direction that we're moving with technology. We'd like to start today's lecture with defining ethics and morals. These definitions on your screen are pulled from the Webster Dictionary. You will find, however, that these two terms are interchanged often. As defined by Webster Dictionary, ethics is the principles of conduct governing an individual or a group. You will find that ethics is often something that is shared. As compared to morals, this is often something that is more personal, and it's relating to principles of right and wrong behavior. For purposes of this lecture and for conversations of ethics embedded in medical encounters, we like to use these two definitions for ethics and morals. When you put ethics and morals together, that's where we often come up with our own personal code. Ethics is sometimes understood as a set of rules or principles, as a state of character, human choice. It's, like I said, it's interchanged with morality, a field of study. For purposes of today's lecture, ethics as applied to medicine, we focus on that field of scholarly inquiry, like we were talking about, that it's categorical, it's not behavior. We're not seeking a rightness or goodness. It's actually the study of morality, and that's the ought, might, could, should questions. So ultimately, ethics can be a source of moral guidance. When we talk about ethics as it is embedded within medical encounters, we're trying to strive for a balance. It's an act of balancing to cultivate an end result, not determining what the one single correct or right answer is. And the hardest part of all of this is to acknowledge that a choice may present several acceptable options. We like this quote by Albert Johnson, a leading scholar in the field of bioethics. But ethics in medicine is defined as a moral limitation placed on power. And you can see this quote on your screen today. What we're focusing on here is that ethics in medicine is dedicated to the strengthening of the weak. And the weak can be found in many different forms, but what we're trying to say here is that when we look at ethics in medicine, it is to uplift and to empower. And that is within strengthening of the patient and the family and whomever is brought into this situation. Ethical issues and ethical dilemmas. Ethical issues arise normally as part of practice. We wanted to take a moment to clarify this so that it is easier to better identify them in your own healthcare situations. Ethical issues are things such as confidentiality, privacy, informed consent, so the documents that you fill out before a procedure or a test. Decision making, that's something that we talk about with you making your own decisions, or when you are unable to, having an advance directive and a surrogate decision maker, someone who would help assist make your decisions. Ethical dilemmas, they differ from ethical issues because ethical issues are something that are embedded within every medical encounter and something that we identify, address, and we can roll right through. Ethical dilemmas, they create more of that yuck feeling that we call it and maybe elicit a feeling of a crisis. It may not yield clearly good or clearly right answers, and you can see some of those examples of ethical dilemmas that are found within genomic medicine. The third category that we like to focus on are personal conflicts. And this is where we really differentiate between ethics and morals and what that means to you personally. Ethical issues and ethical dilemmas are something that we can study, and you may have discussions with your healthcare practitioner, or it may elicit an ethics consult. Personal conflicts arise when you have a personal belief that is not consistent with the majority consensus. And you'll find that stirring within you is something from your inmost being. So contextual features, we call them, but religion, culture, upbringing, your background, your personal experience, biases and assumptions that we hold even if we are unintending to do so. That's where our personal conflicts arise. When we're looking at the field of ethics, we like to think of it as a balloon. So that yuck factor that we're talking about, it's a very eloquent word, very sophisticated for something that is stirring within you that just isn't feeling good or right, or it's making you feel very unsettled. So you identify that, and we think of this as a balloon. You have that yuck factor, and you start to blow up your balloon. You're blowing up the balloon with all the other facts to the situation. And this could be yours or a family member. It could be a conversation that you're having with your healthcare practitioner. But you're blowing that balloon up to make it bigger than what that yuck factor initially was. When we blow that balloon up, we are able to go to a new horizon. And from this new horizon, we see things we didn't know we didn't know. We explore new narratives. We see different perspectives. We even learn things about ourselves that we didn't know we didn't know. And we take it from that new horizon to see this yuck, this ethical issue, this stirring within us from a new perspective. And then what we encourage us all to do is to deflate that balloon. That horizon is very important to see the bigger picture at hand. But by deflating the balloon, we really pick through that narrative and we ask some important questions. So what truly is the ethical question at hand? And we arise at that question and the answer to that by asking, so what information is relevant? We blew that balloon up and we gathered a lot of narrative, but what is truly relevant to this question at hand? What are the available options and consequences? And perhaps resources available. And then ultimately, we step aside a little bit and we say, so what does this have to do with me? That's where the ethics and ethical issues, dilemmas, and moral conflicts come into play here, because sometimes we start to feel other people's yuck factors and we recognize that it really has very little to do with us. Once that balloon is deflated and we start to realize what our ethical question at hand really are, we might start to recognize that we need a little assistance, or what we like to call tools in our toolbox. It's because Our sources of moral guidance are disagreeing with either the general consensus or another person's opinion, or even what has been studied and what we are holding true deep inside. So when we recognize that there's some sort of disagreement, we really encourage individuals not to just stay in that disagreement. That would be more of a paralysis. Rather, this is where you can become curious and seek different ways of seeking resolution. Because in doing nothing or staying in what we like to call that moral stalemate or paralysis, we're making a conscious choice. And that choice of doing nothing has significant consequences on your own health care or maybe a loved one. So we attempt to resolve the disagreement. The next few slides that we'll go over here are those tools that you can put in your toolbox. These are some of the resources that we hope to equip you with.
So as Gretchen mentioned, the next few slides will talk about the various tools that we can put in our toolbox to attempt to resolve some of these ethical considerations or concerns. The first set of tools comes from a series of ethical principles and is a standard framework for decision making introduced by Tom Beecham and James Childress back in their first edition of this book, Principles of Biomedical Ethics, was written and published in 1981. And in there they define 4 different principles for decision making within ethics. The first in the upper left is autonomy or respect for persons. Now, autonomy and respect for persons is primarily the driving force behind ethics and decision making in the United States. With that goes a series of important sub-principles. So that the patient has to be actively involved in their care, that they have to be informed about what procedure or process is going on, and that it has to be voluntary for them. So they have to agree to be able agree to the process or the procedure. All right, in the upper right is the concept of justice. Now, justice is known by a series of different concepts. One might consider it a fair distribution of resources, or that individuals as a group have adequate access to health care. But justice is an overarching theme of making sure that there is appropriate distribution. The bottom 2, non-maleficence in the bottom left and beneficence in the bottom right, are often considered flips or opposite sides of a coin. Non-maleficence is a principle just simply known as do no harm. It's often found in the various codes and conducts of ethics for physicians, nurses, pharmacists, various healthcare providers. Again, to do no harm is the main principle, and by that we mean that we're avoiding intentional harm. The other side is beneficence on the right. That's the duty to the duty to benefit. So more than just that, to benefit the individual is the duty to promote health and cure illness. Now, when we take these 4 principles as Beecham and Childress introduced, sometimes classically it was thought of as a weighing of 2 different principles as if on a scale, but really the concept, the figure in the middle is immobile, and really that's what we're taking. We're taking these 4 different ethical principles and we're weighing them all against each other, so that some at different points in a conversation or ethical concern can weigh differently, and so that we have to rebalance them and take the various different principles into account. So a second set of tools that we often use within our ethics committee here at Sanford is a framework known as CCPR. CCPR is unique insofar as it focuses on the covenant between the physician or nurse or medical provider and the patient covenant with their family and each other. And this covenant is often framed in the context of the AMA Code of Ethics, or the Code of Ethics for nursing, or the Code of Ethics for any other professions within the medical system. The covenant is important, and the framework here provides both context and the principles and theories as we discussed previously, and ultimately the goal is to provide a response, a resolution, or a recommended action. This is a resource that was published in 2005 by a number of the physicians and ethicists and nurses within the DeGroot Center, is an option or a resource that is available for the general public or the Sanford community whenever is needed. There are several other tools that we can use to discuss ethical decision making. However, one of the most simplest is provided here. So this is just a basic ethical decision making model. And you consider that on the top or across the top, we can consider harms and benefits of doing something or not doing something. And then over on the side, consider doing the treatment versus not doing the treatment. So in each of these cases, we can consider the harms and benefits of doing something versus not doing it. Now, what's important here is that often we consider that doing a treatment has harms and benefits that go along with it, but what's important here is that we consider that not doing the treatment, as Gretchen discussed earlier, has consequences. And so the harms and benefits of those also need to be decided. And so we've spent a lot of time talking about the various frameworks and how do we apply those ethical frameworks to medicine in general? Well, ultimately, the question becomes, where do we use these tools to resolve ethical dilemmas and personal conflict that Gretchen discussed earlier? And so the main 2 bullet points here at the top that are highlighted really resolve many of the ethics concerns that we have, in that mindful conversations between patients, family, and healthcare workers often is the source of resolving these issues. If we take the time to have the conversation, think about the discussion, and blow up that balloon, have that discussion, oftentimes it resolves the issue. However, if it doesn't, we often rely on our ethics training and education and the individuals such as ethicists that are involved in this process of discussion and conversation. And so the 4 bullet points below, ethics consultation, ethics committee, those are processes that happen on an institutional level that we have for resolving these issues that just simply people have a hard time discussing or the conversation is not easily resolved. And then of course, the bottom 2 points, institutional policies and procedures and laws and regulations are things that our ethicists and our physicians, nurses, and the healthcare system in general puts in place to help these issues before they happen.
So before we start discussing a few cases, because everyone loves to discuss cases and ethics and think things through, and sometimes that rattles the cage a little bit, but we're going to go beyond that. But some of the topics that kind of preclude that are, when we discuss the unique ethical concerns in genetics and genomics, discuss the unique ethical concerns in genetics and genomics. First, there is uncertainty about new technologies. There are some tests that have been FDA approved and some that haven't, and trying to decide which is better for an individual or a family. There is also the discussion of inheritance. There's individual rights versus the harm to others. So family members that maybe don't communicate well and choose to withhold information. Is that the duty to inform? Is that harmful to other individuals in the family? There's other people in the family who refuse to know genetic results, and there can be harm to other family members, such as their children, who do wish to know that information. And then, of course, that all ropes into privacy and confidentiality. So an accidental disclosure to family members, employers, or insurance. There is federal laws that to protect individuals in some of these aspects. But then, of course, lastly, we have incidental findings that we can have when pursuing a genetic test result. So going back to this framework here, I think this is a very useful tool when we're trying to blow up that balloon. So as we go through these scenarios, we get that ick factor. Using this is going to force you to look at all sides of the case, and from there, that's where a ethical discussion can occur with a family member or the medical team. So as you look at this box, you can see that the top doesn't change. We always have the harms and the benefits, but on the side, that's where we can make this unique to our cases. So let's discuss those cases. I'm going to read them out loud and then have you guys discuss them and think about them, and maybe even just handwrite this box and pause the video and think about these on your own. Amy is grappling with whether she wants to know if she is at risk for developing Alzheimer's disease. However, her brother Peter is an information seeker and planner. Peter has already undergone genetic counseling and testing and was found to have a deleterious mutation in the PSEN1 gene. Given this information, Peter and his wife met with a financial planner and lawyer to develop a legal and financial plan that will protect his family once he develops symptoms of Alzheimer's disease. Peter and his wife also want to plan financially and legally for their children, and they believe that knowing whether Peter is at risk for developing Alzheimer's is critical to appropriate planning. Thus, Peter and his wife requested that their 5-year-old son and 8-year-old daughter be tested for the PSEN1 gene mutation. So as you look at the box here then, again, hopefully you have a piece of paper handy and can draw this out. Thinking about on the top, again, harms and benefits, and along the sides, we have to test the children and to not test the children. And as we think through, what is the harm in testing the children and some things that could come to mind. So looking again at this tool, we have our harms and benefits across the top, and on the side, you can write in to test the children, and then below it, to not test the children. So if you would just please pause the presentation at this point and kind of talk through that yourself or think through it yourself and try to write in some possible answers for these boxes, and then we'll resume when you're ready. So as we think about the top, if we're thinking first the harms in testing the children, off the top of my head, I think about their own right to choose. So if you think about the first discussion or the first point of interest is, to test the children, what are the possible harms? And the first thing I can think of is the children have lost their autonomy in making that decision for themselves.
It's really interesting because this invites a conversation of the age of assent. And so seeking consent, and we've talked about informed consent as an ethical issue embedded within genomic medicine. And when it comes to pediatrics, we have an age of assent, and that is ever changing within the field of study. But right now, they're really focusing around the age 7.
Yes. In moving across that box, then, to test the children, are there some possible benefits?
And that's always the surprising box, because sometimes when we think that we have our answer made up in our mind, we're surprised with finding the opposite or opposing viewpoint that something that we thought was harmful could elicit benefit.
So a benefit that I can think of is maybe within their lifetime, there is a trial or a treatment available that possibly, if we knew that these children would be at risk for Alzheimer's disease in adulthood, maybe introducing a treatment to them in early adolescence could actually be quite beneficial to them. But if you hadn't done the testing, we wouldn't know that they would be able to participate in that. So then the bottom box, to not test. Are there harms then to not test? And I would, echo the possible benefits in testing. Other harms in not testing, would be uncertainty for parents. Sometimes it's agonizing to know that your child may be at risk for a hereditary condition, and because they aren't adults, you have to sit and wait for that child to become an adult and decide for themselves. So then finally, we have our final box, to not test. Are there benefits? Again, that kind of echoes back to the harms in possibly testing, is you are giving that child back their autonomy and deciding if they would like to test as an adult.
So that was just one example of utilizing that harm benefit or risk benefit 4-box method. We left the left side intentionally open because you could place any of these scenarios or any of the issues that are kind of reaching out to you in this case onto the left side. And so you look at this case 1 and you see that there are many different elements of where ethical issues could bubble up and you might have to have a conversation. So we're looking at Amy and her need to know or curiosity. We're looking at Peter. So you have different family members involved and you see finances and legalities. And so you can take any of those questions that start to arise for you and place it within that 4-box method and have an action or an inaction or 2 different actions that could take place and start to weigh the harm, risk, or the benefit and explore the different boxes.
So, going back to that box, we mostly talked about the medical benefits and harms to the kids in doing the testing, but there's also social and familial implications, such as if they did the testing for their children and found out that the daughter did not inherit the risk and the son did, Moving forward, the parents may choose to treat their children differently based on those genetic test results. Or even further on, when writing their wills, may choose to leave the majority of it to their daughter and only provide financial well-being for their son to be treated for in a facility, not knowing that there's a treatment available at the time that they wrote their will. So the next case, is kind of an interesting case because it's a little bit newer and actually being incorporated in many medical facilities. John is a 48-year-old man who had coronary artery disease and had a stent placed 1 week ago. He was started on a blood thinner after the procedure and had pharmacogenetic testing done to confirm that his medication will work correctly. The PGX test revealed that he does not correctly metabolize the medication, causing it not to work, and his doctor switched him to another medication in this class. When John arrives at the pharmacy, he is informed that his insurance does not cover this medication. It will cost more than $400 per month out of pocket. Based on his current financial situation, he cannot afford to pay for the medication.
Now, there may be some questions about this case in terms of the specifics. Specifically, I'm sure about what the word pharmacogenomics means. Now, pharmacogenomics is a field of study that I specialize in which we look at the various genes that individuals have and whether those genes affect how they clear or metabolize or their body gets rid of medications. And so in this case, we use the case of a blood thinner. There are certain blood thinners that do have different pharmacogenetic effects in that it can cause either the medication to work or to not work based on the patient's specific genes. So returning to the ethical decision-making model, this 4-box method, we consider over on the left side our options. And when we discuss this, what really comes to mind for me is to do the testing up front or not. Now, this is often a consideration for the medical provider themselves, but patients oftentimes have a role to play in this, and then the decision can oftentimes be presented to them. So would a patient want to know this information if it means that potentially the medication cost could be hundreds of dollars more than a therapy that's over the counter, not over the counter, but generic? And relatively inexpensive. So when we talk about harms versus benefits of having the testing, harms, the first thing that comes to mind is very obvious. If a patient has this testing done and they're found to not metabolize the drug correctly, the financial harm is fairly obvious. So that was the first thing that comes to mind. When we talk about the benefits of knowing this information, well, certainly even if the cost aside, the benefit of knowing this, if you have a medication that's not functioning or not working for you, clearly the benefit is that you now know this and can get the proper medication. But conversely, then we talk about not doing the testing and what the harms and benefits are there. So if you choose not to have the testing, the harm is basically converse of the benefit of knowing. In that you just don't know. So you could be exposing yourself to potential harm or not. You just don't know. So the harm is the lack of knowledge of information that you could have otherwise. The benefit is that maybe you get the peace of mind of not knowing. So it would be as if years ago we didn't have this test and we just didn't know. So certainly, I guess ignorance is bliss is maybe a potential benefit in this case.
Thank you so much for joining us today and watching our video about yours, mine, and ours, discussing ethics and medicine. We hope that we provoked some thought and possibly more questions. And if you have more questions and wish to discuss, we welcome you to contact us at Imaginetics. The website should have all the phone numbers listed, and we would welcome any further discussion. Thank you.